This is a CJASN podcast, and I am Dr. Jeffrey Saland from the Icahn School of Medicine in New York City. I'm pleased to share the results of a Phase 3, 60-month trial which evaluated the long-term effects of Lumasiran for the treatment of primary hyperoxaluria type 1, or PH1. PH1 is a rare inherited disease in which the liver overproduces oxalate. Excess oxalate accumulates in the kidneys, leading to calcium oxalate crystal formation. Over time, this can cause kidney stones, nephrocalcinosis, progressive kidney damage, and in severe cases, kidney failure and life-threatening systemic oxalosis. The primary goal of PH1 treatment is preservation of kidney function. Historically, treatment options have included intensive hydration, medications to prevent crystal formation, vitamin B6 for certain patients, dialysis, and dual kidney liver transplant. These approaches often place a substantial burden on patients and caregivers and significantly impact quality of life. RNA interference therapies that target the liver enzyme responsible for oxalate overproduction have been developed to treat PH1. Lumasiran is an RNA interference therapy approved for pediatric and adult patients with PH1 in many regions worldwide. ILLUMINATE-A was a multinational trial that enrolled adults and children aged 6 years and older with genetically confirmed PH1 and relatively preserved kidney function. After an initial 6-month randomized placebo-controlled phase, all patients received Lumasiran in an open-label extension for up to 54 months. The final 60-month results demonstrated sustained reductions in urinary and plasma oxalate levels to near normal levels, with an average 54% reduction in urinary oxalate. Kidney function remained stable over time, with minimal changes in estimated glomerular filtration rate, GFR. This is in contrast to the progressive decline in kidney function that is generally expected during the era of historical pharmacological treatment options. 54% of patients experienced no kidney stone events during treatment, and most patients with nephrocalcinosis at baseline showed improvement or complete resolution by the end of the study. Stable or modest improvement was seen in health-related quality of life measures, which again is notable given the expectation of decline in patient quality of life during the era of historical treatment options. Lumasiran demonstrated acceptable safety outcomes. Most adverse events were mild or moderate, and because Lumasiran is delivered as a subcutaneous injection, injection site reactions were most common. Serious adverse events were infrequent, and none were considered related to treatment. To summarize, primary hyperoxaluria type 1, or PH1, is a rare genetic disease causing excessive oxalate production that may lead to progressive kidney damage and potentially life-threatening systemic oxalosis. In the ILLUMINATE-A study, long-term treatment with Lumasiran produced sustained reductions in urinary and plasma oxalate, stabilized kidney function, reduced kidney stone events, improved nephrocalcinosis, and resulted in signs of improved health-related quality of life with acceptable safety. These findings support Lumasiran as an effective long-term therapy for patients living with PH1.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.